wherever you come from tonight to join this Zoom meeting. Focus tonight is about young carers, and some of it might frighten you, but it's very much the reality of the lives of young carers and all carers. I'm David Fryer. I've been leading a small working group of Rotarians in Scotland, and this is the third in a series of meetings we're having to look at the issues for unpaid carers. Two particular formalities. Please turn your mobile phones off if you haven't already done so. And just to reaffirm, it is being recorded. If you don't want to be recorded, can you turn your camera off? You have your reasons. No one needs to know that. Please do that if you don't want to be part of the recording. We are very much seeing this will become the next in the series of YouTube presentations, of which the other two are already there and available if you want to go back to them. For tonight, we're going to be meeting for about an hour. We will have with us tonight Paul and Lorna from Carers Trust, and a young carer herself who is hopefully with us now. Jo?
Yeah.
I'm sorry,
No.
David, I can't see.
No, she's not in yet.
Not in yet.
No.
She
Okay,
just sent a message saying she was trying to join, so hopefully she'll be with us in a wee minute.
no problem.
That's
No problem.
brilliant. Thank you.
One other part of the proceedings is we welcome questions and comments, and there is the chat button right at the bottom, or the bottom of your screen, and to pick up on that is Jo, and hence the description questions Jo, and we will look to either comment or ensure that there's a follow-up to this as well. There needs to be a place to say it. We're all in a very difficult time. The whole cost of living crisis issues that are slowly and rapidly unfolding around us, and what that will mean in terms of how it impacts on lives. I'm certain either Paul or Lorna may be picking up on that. Perhaps Rachel herself will pick up on that. But it's something we're all concerned about, and it's really on a par with COVID. It's going to affect everybody. There's nowhere to run. We don't know what the consequences will be or how long it will go on for. So it's yet another big community issue, a humanitarian issue. And Rotary, I hope, is well placed in terms of its membership and its localities to be a resource that can support within their localities. The one thing we did earlier is we heard of where other Rotary clubs were able to give a focus and help out in particular ways that were very relevant in their communities. We'll hear a bit more tonight, but the focus tonight will be about young carers. And is Rachel with us?
No, not yet.
She's just sent me a message saying that she's having to reset her Wi-Fi, the joys of technology. So she's saying she'll hopefully be here in a few minutes.
That's fine, no worries. Do you want to, I've interrupted you, David, I do apologise. Do you want to move on to Paul and Lorna, and then hopefully Rachel can come in when she joins?
I'm certain Rachel will keep in touch with Lorna, but good suggestion. Let's start to use the time we've got. Paul, Lorna, over to you to give us an introduction and tell us a bit about what's happening.
Great, and thank you very much everyone for having us along. As we were kindly introduced, I'm Paul Traynor. I'm Head of External Affairs at Carers Trust Scotland, and we are the national carer organisation which has a focus on young carers. I'll let my colleague introduce herself.
Hi everyone, thanks very much for having us along tonight. My name is Lorna Gibson and I work alongside Paul at Carers Trust Scotland, and I coordinate a network called the Scottish Young Carer Services Alliance, which is an informal network of over 51 young carer services across Scotland.
And I'll just maybe pass over to you, Lorna, to take us through the start of the presentation.
Okay. Paul, did I just say next slide to you to move on? Thanks very much. This is when we feel like we're in a game show. Next slide. I believe you guys have already had an initial presentation about unpaid carers, but just in case anybody wasn't along there, when we're talking about unpaid carers, we're talking anyone who provides unpaid care for a friend or family member who, due to illness, frailty, disability, or a mental health problem or addiction, cannot cope without their support. But more specifically, moving on to the next slide, Paul and I are here tonight to talk about young carers. So when we talk about young carers, we're referring to somebody who's under the age of 18, who helps look after someone in their family or a friend who's ill, disabled. They might have a mental health condition, or they may misuse drugs or alcohol. Many of the young carers that we work with might be looking after more than one person, and they may have health issues of their own. Some young carers start giving care at a very young age. Some of the services that we work with are supporting young carers as young as 5. Quite often young carers don't know that they're a young carer, and for other young carers, they may become a carer overnight. So what kind of roles and responsibilities do young carers have? Now, this is not, every young carer's situation is different, but here are some of the tasks that they might undertake. They might be taking practical tasks such as cooking, housework and shopping. You might think, well, other young people do that as well, but they might be doing it. They might be the person that's leading in that in the house, that they are responsible for the cooking in the house, they are responsible for the housework, and they are responsible for the shopping. It can quite often involve physical care, such as helping someone out of bed. A lot of our young carers we work with are providing emotional support, such as talking to someone who's distressed or having a manic episode. It can be personal care, such as helping getting someone dressed, maybe managing the family budget or going to collect prescriptions. And quite often young carers are also responsible for giving out that medicine, and they can have really quite complex knowledge about medicines and healthcare. It could be helping a family member to communicate, and that might be translating from one language to another, or it could be supporting somebody who's non-verbal communicate as well. And they could be helping look after a brother or sister. And our young carer services we're working with are certainly reporting seeing an increase in sibling carers as well. So they might be responsible for getting that young person to school and making sure that they're getting to where they need to be. I know Paul's going to talk a wee bit more about the facts and figures of young carers in Scotland. And once he talks about that, you'll see that there's the young carers that we are supporting through our network, and a lot of young carers who aren't getting support, and that's because so many young carers still remain hidden. And just wanted to go through some of the reasons that might be. It might be the condition of the person who's cared for, and I think traditionally when people think about unpaid carers, it's like that image of someone pushing a wheelchair, and that quite often might not be the case. So people aren't seeing a visible caring role, so they're not asking the questions. And again, that relates to not having the opportunity to share their story. If the person they're caring for is an adult, for example, and they're maybe getting people coming in during the day to offer them support, or they're going to medical appointments, the young person won't be there because they'll be at school. So nobody's kind of involving them in those conversations. So they're not having that opportunity to talk about it. And again, they might not be putting their hand up at school to say they're a young carer. So nobody's really asked them or been able to share their story. Quite often young people don't actually want to feel different from their peers, so they don't, again, talk about it at school. They don't feel that they want to talk about it with their friends. So again, that knowledge isn't going anywhere. It's not as if a friend can say, well, I know somebody that does that as well, and they get extra help. And there's still that kind of misconception as well that if they ask for help, the family might get split up, that social work's going to come in and remove people from the family, so they're worried about the family being split up. And again, that can involve the adult in the family as well, maybe not wanting to highlight that they're getting support from their child and young person as well. Might be a bit of embarrassment about being a young carer as well, depending on what the condition is, if it's drug or alcohol addiction. And again, that relates into maybe being worried about the family being split up. But quite often it's because young carers don't know that they are young carers, and that is why it's so important, the work that we do within Carers Trust Scotland, to go out and raise awareness of young carers, who they are, how to maybe identify young carers as well, so that we can make sure that young carers are getting the support they're entitled to. And I'm sure Paul would agree with me, no matter what kind of awareness raising sessions we do, undoubtedly there's always someone in the room that's like, has that light bulb moment, like that they might know somebody that they think, oh, wait a minute, I think they might be a young carer, or might even relate it back to themselves in their own childhood and think, well, that's what I did. And I know that certainly we've had MSPs and decision makers say that to us as well. So how does being a young carer affect a young person? It can affect their physical health, if they are repeatedly lifting a heavy adult, if they're maybe being responsible as well for the cooking and the shopping, it's maybe not buying the kind of healthiest of food, so it might be a poor diet and a lack of sleep. I think we can all relate to, if you've had a bad night's sleep, how that can make you feel. But if you're up during the night caring for somebody or administering medicine, and that's a repeated pattern, you can imagine how that physically impacts you as well. Emotional well-being is a massive one. Young carers can quite often feel stressed, they're tired, and their own mental health can be affected as well. And that's what we're really hearing as well, particularly since COVID lockdowns, that their mental health has been impacted. I mean, being a young person is stressful enough as it is. You've got your friendship dynamics, trying to do well in school, and then if you're putting caring responsibilities on that, you can only imagine how that can impact a young person's emotional well-being. We often hear from young carers as well that they can feel quite different from their peers or isolated because maybe they don't have the financial means within the house to go and do extracurricular activities, or it's that worry, like, if I'm not at home, is my mum going to be all right? Is my dad going to be all right? So quite often feel isolated. And also we, through some of our studies as well, have found that young carers are more likely to be bullied at school as well, which can impact wanting to go and do extracurricular activities. And quite often that stable environment isn't there, can experience quite traumatic life changes, whether that's family breaking up, loss of impact, can also be bereavement as well, and the effects of maybe illness and addiction in the person they care for as well.
The primary piece of legislation in Scotland that actually supports all carers is the Carers Scotland Act. And the Carers Scotland Act was in 2016 and was enacted in 2018. And there's the specific piece within the Act of support for young carers is around the right to a young carer statement. A young carer statement is quite similar, if people are aware of, previous carers assessments or adult carer support plans. So it's a young carer version of a support plan to really assess their needs as well. Within the young carer statement, it needs to look at a whole host of stuff, including emergency planning, the young person's personal outcomes, looking at their own aspirations in life, and also their willingness to provide unpaid care for the person they care for. The thing is not most young carers don't have a young carer statement in reality, although they all have a right to one, and some of those reasons were highlighted by Lorna earlier, which is many young carers are just unidentified as well. When we think about young carers in Scotland, Scottish Government recognise that there's around 30,000 young carers in Scotland. However, our studies have estimated that 1 in 5 child or young person in every single classroom in this country has some level of a caring responsibility. That doesn't mean that they're primary carer, but they have some level of caring responsibilities. That brings that total actually closer to over 100,000 young carers in Scotland as well. And out of those 100,000, a very small minority actually have a young carer statement. Somewhere around less than 5,000 young carers have a young carer statement in Scotland, and they're statutory right. I'm actually just going to skip over. We're the National Carer Organisation, as we said, around focusing on young carers. Through our work, we reach around 30,000 unpaid adult carers, and we reach around 5,000 young carers. So if there's 100,000 potentially, or even if we acknowledge the Scottish Government's official data of 30,000 young carers in Scotland, we're only reaching still a very small minority of young carers who are actually in Scotland. Some of the reasons, there's real issues around data collection as well for young carers in Scotland. Most of the official statistics that report on young carers are filled out by adults. They're usually the census or the Scottish Health Survey, which do not go directly to young carers. So often one member of the household will fill out these official statistics for the entirety of the household. And perhaps there might also be reasons within the household that parents maybe don't see their other children as young carers, because maybe they see themselves as the carer. If a parent is caring for a disabled child, they might see themselves as a carer, but often might not actually think that the other people in the household are also carers, which the reality is that if there is someone in the household with a disability, everyone in the household will have some level of a caring role. The one thing that we do run in Scotland is the Scottish Young Carers Festival. It's an annual festival for children and young people. And I think Lorna's going to tell us a wee bit more about the festival.
I could literally talk to you about the Scottish Young Carers Festival all night, but I won't. The Scottish Young Carers Festival is an annual event that has taken place since 2008. For obvious reasons, it's not been in person for the last couple of years, but this year we were absolutely delighted that we were back in person, and this was held from the 2nd to the 4th of August at Fordale Firs Outdoor Education Centre. And the purpose of the Young Carers Festival is we bring young carers together from all across Scotland. So we had about 500 young carers on site, and it is about them getting a break from their caring responsibilities. It's about them having loads of fun, and they're very involved in building the programme throughout the year. It's about them meeting other young carers as well, because as I mentioned earlier, young carers can feel quite isolated. So if you feel quite isolated and nobody understands what you're maybe going through, can you imagine coming on site and there's like 500 other young people there that will have different caring responsibilities from you, but have that common understanding? It's amazing. But also for us at Carers Trust Scotland, one of the most important elements is that we are able to consult with young carers on what are the challenges for you, but also what's working well for you, because we're always really keen to find out examples of good practice that are happening across Scotland. So we're able to kind of gather that intelligence and share it with our young carer services, share it with decision makers, Scottish Government. And at the festival, we invite MSPs to come along, heads of council, heads of NHS boards, heads of education, and they are able to come and speak to the young carers and find out what's working well for them. And what I would say is it's very, very hard for these decision makers to go away after they have heard directly from a young person about what would make things better for them, and not to follow up in those actions. And we're really proud that there's been many actions that have come out of the Young Carers Festival, but again, I think that would take all night to run through our Young Carers Festival. But it's a fantastic event. So as you can imagine, at the Young Carers Festival, quite often some of the challenges young carers talk about is schools. That is where they spend the majority of their time. So we know that in some schools they are really on it. They know who young carers are, they know the challenges they face, and they've got really good examples of support in there. But what we want to do is make sure that that is across the board in Scotland, that it doesn't depend where you live and what kind of support you're getting. So Scottish Government funded a role within Carers Trust Scotland for primary and secondary education, and our colleague works at a national level to raise awareness of young carers so that it's up there on the national agenda. And she delivers free young carer awareness training to all education staff, probationers, because we want to get teachers, when they're going into the start of their careers, that they're thinking young carer straight away, student teachers. And I think here it says that there was over 600 probationers and student teachers that received training during 2020 and 2021. And we also have education doesn't stop at secondary, and our research that Paul very much led on showed that student carers were more likely to drop out of college and university. So again, it's really important to make sure that there is an awareness of unpaid carers within colleges and universities. So we developed a award called Going Higher, which is for universities, and Going Further, which is for colleges. And that's an award that they can apply for so that they can demonstrate that, number one, they're identifying student carers, supporting them and reporting on them as well. So there's that whole institution support and awareness of the issues that unpaid carers face, and to make sure that they're not missing out in that education as well.
One of the other things we've been doing at Carers Trust is we also undertook a bit of work about looking at a whole family approach to supporting young carers, looking at the whole family. And one of the best ways of supporting young carers is actually ensuring that support's in place for the cared for person and the wider family. So we're really keen to continue to do that work, and also encourage young carers to be able to have open conversations with their family about how they're feeling about their caring role, as well. And we've created a whole bank of resources for local carer services and for young carers and their families themselves to use, such as conversation cards to allow young carers to have structured conversations with their families and also their cared for person, and also with decision makers and services around actually the importance of listening to young carers and being able to communicate openly around that. We also run Young Carers Action Day. So this year it was on the 16th of March. Young Carers Action Day next year is on the 15th of March. The theme last year was on taking action on isolation, and that was very much highlighted from research we undertook from young carers who felt very isolated during the pandemic, particularly young carers who were shielding or partly shielding throughout the pandemic. And one of the things that around education, which is interesting, one of the other reasons around unidentified young carers is many young carers really missed the opportunity to actually go to school in person. Because one of the things many children, young people wouldn't think about, but actually for many young carers, going to school is a break from their caring role. But actually during the pandemic, when they were in lockdown and at home, a lot of young carers' caring role actually grew over that time. Also at that time, a lot of daycare services that maybe the care for person might have attended or other services shut. So it then meant that there was a more onus on the family to take on more caring. So children and young people with many children and young people with caring responsibilities were trying to study at home and also had more intense caring roles. And very much we highlighted as part of Young Carers Action Day that it was really important that young carers get breaks from their caring role to reduce social isolation, and so that they're able to be children and young people first and foremost as well. I'm just a wee bit aware of time, so I'm maybe just going to skip a couple of slides. Because I think it's quite important we've got a wee video which lasts just about 2 or 3 minutes, so I maybe put that on before we hear from Rachel.
A young carer is a young person who cares for someone in their life.
The person who needs care could be a family member or a friend. They could need physical or mental support and might not live with the young carer.
We often have extra challenges to overcome than other young people.
There's a lot of emotional, practical support needed on a daily basis. Just depends on the needs of that day.
Before I was a young carer, I was with friends all the time. After, it was just really difficult to make the time to go out with friends.
Studying's kind of pushed away, and social life, well, it's not really something I would even think about, honestly.
I never found out about it until last year, about what a young carer was or what a young carer does. But it turns out I had been a young carer for quite a few years.
Education is a big part of our lives and is often also one of the biggest challenges.
Some schools are understanding with lunchtime groups or a dedicated teacher that champions young carers, but that's not always the case.
After Mila's diagnosis, I found it really difficult to focus on exams and studying.
Sometimes in the morning the taxi is late to pick up my wee sister, which means I'm late for school, and I don't really want to tell my teachers why I'm late.
Teachers don't know what actually happens and they just assume things. Like, I have issues, maybe I'm out with my mum one night and homework's been the next day. It's not going to get done on time.
Sometimes with schoolwork you can need that extra help and support, and sometimes you don't actually get the help and support.
We need to feel comfortable to say that we are a young carer, and staff need to be upskilled in supporting us.
Not only in schools, but everyone in society needs to know who young carers are and how best to support them. We need to be more visible.
In my culture, it's really not a thing. Like, it's just seen as something you have to do because it's your family. So I definitely think that there needs to be more exposure about it.
Some days it's like you feel like there's no one to talk to. You feel like there's just no one that you can turn to for advice. There needs to be more awareness in school, some lessons on what a young carer is, and helping to find other young carers.
They need to be educated on what a young carer is, because they don't understand that a young carer is different things. It's not just one set thing you do.
Having a break from our caring role is really important.
It lets us do the things that we want to do as young people and recharge.
We need to have short breaks and respite for both young carers and young adult carers.
Looking after and living with someone who has autism can maybe feel like a full-time job.
You wake up and then you think, well, I need to do this again, and sometimes you just feel exhausted.
Physical impact, I've had back pain because of some caring duties, but however, it's just something that you just get used to and you just continue on with it.
You just really want a break, and it's really difficult to get that sometimes.
Finances are hard, money is really tight because of both my mum and my sister not being able to work. We have to rely on benefits. Trying to survive off that it's just really difficult.
It's really hard to get respite and support because if you live in a rural area, there's not as many places to offer it and you have to travel further.
Growing up is different for young carers, but we are the same as other young people. We deserve the same opportunities, but we may need extra support to help achieve our full potential.
Some people don't realise how much things we do miss out on. I think young carers should be acknowledged and recognise us as individuals who need more time to ourselves and be able to be around other young carers.
I found it really liberating almost that there were people who could understand what I was going through and provide support for me.
I think to bring light to young carers, just so we know that it's there if we need the support.
I'm going to stop my screen share now and come back onto the main screen. I hope that people found that interesting and insightful about some of the experiences for young carers. But I think I know that we're maybe running a wee bit close to time, Joel. Are we all right?
Paul, we're okay. I think Rachel's got issues trying to get in. Lorna and I have been texting on the chat and emails and things. Lorna, have you got an update from Rachel at all, please?
I just called her there and she's saying that it's our server seems to be blocking it, so she's trying to go in through a different way. So she's going to hopefully, she was just trying again there.
Okay. I mean,
I can't see her yet.
Don't worry, we'll see her come in. So I mean, Paul, I know you said you'd had a couple of slides that you've missed. Did you want to just carry on saying what you needed to say?
No, maybe it might be a good opportunity to give members an opportunity to ask questions. I think maybe we covered the bulk of what I wanted to cover anyway through that, and I think what the young carers say is probably the most impactful bit of that. So I mean, I'm quite happy to take some questions while we wait on Rachel coming, if that's all right.
Yes, so thank you, Laura. Thank you, Paul. Great insight to the lives and issues affecting young people. But maybe somebody would like some clarification or perhaps some further explanation. Anybody got anything for Paul or Lorna?
Forgive me, my internet is pretty rubbish down here. I can't see anybody, so if I've just overstepped the mark.
So
no, I'm going through.
Okay, couple of things. We were talking before everybody came on the screen that it's very confusing for young carers at the moment. Obviously, we've got the energy crisis, we've got vaccinations. Can you just explain a little bit more about how the different vaccinations, young carers are not getting some of those?
Yeah, before we came on today, I was talking with David and Joe and Andy, and I was highlighting that there's a lot of confusion for young carers around vaccinations. So all young carers are entitled to the flu vaccination rollout, which will be happening during this winter. However, only carers over the age of 16 are eligible for the COVID-19 booster. So young carers, unless the person they care for is an immunosuppressed person, all young carers are not eligible for the COVID-19 booster. There's really confusing messaging because currently the lines that have went out officially say that carers are entitled to the COVID-19 booster, that's not the case. I think, as someone mentioned when they first joined, that's a great example of how young carers are overlooked, because even in that conversation, young carers are not considered, and public announcements are coming out saying that carers will be eligible for the COVID-19 booster, but young carers under 16 will not be eligible. They did not meet they did not make it to the JCVI guidelines and guidance for that booster rollout. So it's very confusing in the same time that there's now going to be vaccination programs rolling out simultaneously. Some will be come get your COVID-19 booster and your flu vaccination at the same time. And young carers may be really confused whether they're actually eligible for either now, but they do remain eligible for the flu vaccination. And one of the other issues that I was saying before we joined is that the communications that come out are usually on official government channels or are on government social media and websites, and they're not very tailored to young people, particularly young carers. How are young carers really going to know? Because very few of them, I assume, are following Scottish Government's health department and following their Twitter accounts or their Facebook accounts. And the guidance that comes out often comes out in guidance reports. So how do young carers get the information in a way which is tailored for them? And so there's a lot of issues and confusion in relation to that. There's also going to be changes in relation to PPE access and access to asymptomatic testing, which will impact unpaid carers. And again, with that, young carers have been overlooked in even how they can get access to PPE and asymptomatic testing as well. So it's a very confusing landscape for them, and we're sort of here to try and help break down some of that and form local carer services, so young carer services locally, about the changes that are coming forward. But generally the public health announcements are really not helpful, and it's a very confusing landscape, particularly for young carers.
Thanks, Paul. I think Ken's got his hand up. Ken McClellan?
Yeah, thanks very much, both of you, for that very insightful presentation and just bringing us to realise the real issues that's sitting under there. I guess my question is, so you talked about how many different organisations there are for young carers in Scotland. How best is it to coordinate that, and how can Rotary make a difference? And how do they integrate with that 10 or whatever it is organisations to make that difference with the carers?
Lorna, do you want me to take that one? Yeah. We coordinate through the work that Lorna leads on, an alliance of all the young carer services in Scotland. We've got over 40 young carer services in Scotland who are based, in every part of Scotland. We are certainly able to be a conduit to linking into knowing where your local carer service is, and happy to provide details to be contacted directly if any Rotary want to make those direct links with a local carer service for that. Most on our website at carers.org, we have a list of all the local carer centres and local young carer, all the carer centres and local young carer services in Scotland. So you are able to find where your local carers organisation is, but certainly drop us a line directly and we'll be able to signpost you and link you up with that. Sorry, Lorna, I see you've came
Sorry,
off
Paul, to leave you with that one. I could just hear two of my wee girls are going to their bed right now, and one of them's not very happy, so I don't want to switch my microphone on there. But yeah, as Paul said, I work really closely with the young carer services, so more than happy to put the links in it. It's actually over 51 young carer services that we're in contact with. And what I would say is they've all got different, they all work completely differently, as is quite often the case. So that some of them are quite big services and offer a whole loads of range of support, and some of the services maybe only have a worker that's resourced to work 12 hours a week. So they're all quite different, but we're all excellent. So more than happy to make those contacts. Sorry, Paul, to leave you with that one there.
That's great, thank you. I guess how Rotary could have most impact depends on where we are and who the local services is it. And I guess that perhaps we could put on our websites where that is throughout. I mean, obviously throughout Scotland. I mean, 1010 as sits against my name is everything north of the Firth of Forth, from Shetland to Stornoway to Alloa, and everything in between. So the interface can be quite diverse, I guess, is it? And the needs of each group will be probably diverse, is it?
Yes, and I think you've highlighted a really important point there as well, Ken, and highlighting that all young carers are individual as well, but also depending on where your local carer service is, may depend, what wider services are available. There's, as you will expect, there's a lot more services for young carers based in the Central Belt than rurally, and even the capacity of the service often reflects that as well. So many services, young people might have to travel. If they're in the Highlands, there's some young people who have to travel quite a distance to come to their local carer service, or if you're on the islands, depending on where you are, your carer service is probably in the main town, but you may live in an island which is not near the main town. So there's all these difficulties for young carer services, as you expect. Sort of if you're on the sort of Central Belt, that's where where most services are. But also that's also where there's also a huge demand due to the population numbers of young carers, as they said earlier, as many as 1 in 5 in every classroom. So even though it doesn't mean the Glasgow service is they're probably just as busy because they've got a massive list of young carers versus the service up in Shetland, for example, which is currently I think has 35 young carers on their records in Shetland. So it's interesting how we do that, but yeah, we can certainly link you up. And if you're covering areas which cover multiple local authority areas, that's multiple young carer services as well. So it's not really, one central service. It might be multiple services, but we'd be happy to link you up with any of them.
Okay, and I guess sorry, Irene, one more question, if I may. If you were to say, here's the biggest difference you can make, what would that be?
That's a difficult question, but I think the biggest difference for many young carers, just now, I think it depends when we're talking. I think just now, obviously, financial impact of cost of living is going to be huge. Many young carers live in households that either fully or predominantly rely on benefits. They often live in areas in multiple deprivation due to some of those aspects that they live in households and benefits. So there's a financial issue, as well as the rising cost of living, people who might have machinery that needs to be on all the time, caring for someone who has particular care needs. Many young carers will say education comes up a lot, and it's understanding and access to a requirement for school to be more supportive of young carers. But I also think, and what we hear more so off the back of the pandemic, is young carers actually getting a break from caring and being children and young people, first and foremost, is probably the biggest help that can be done. There's an aspect of being able to provide break opportunities for young carers, days out, more opportunities for young carers to go with their peers, their friends, break down the barriers, which are sometimes financial and sometimes time, that they just don't have the time to be able to do that. And also, in order for young carers to get a break, may require replacement care to come in. So there might not always be another family member available to do that. So how does a young carer take a break if they're the primary carer for someone and there's no replacement care available?
That's great, thank you.
Sorry, again, apologies if I've just overstepped, if somebody else is in the queue. Is anybody else in the queue for a question?
I think Irene has waved a hand.
Brilliant. Sorry, Irene, over to you.
Go for it.
You possibly need to unmute.
I have personally, through family experience and so on, just admire the amount of work that they do. But you don't want to embarrass them or make them sort of, feel different from the others. So is there an East Lothian one that, I can coordinate with, that we can find what's the best way of supporting them? without making them feel embarrassed at being different from the rest of their peers and so on.
Yes, definitely, Irene. There's a young carers service in East Lothian. Lorna would be happy to connect you up with. And I think if you go directly with the service, the one thing about the young carer service, and this is where we highlighted earlier a wee bit, is that the young carer service are working with young carers who are identified. Those young carers have been identified somewhere down the line. It might be at school, it might be from a family member, they might have self-identified. So many of those young people are often, I think the aspect of being embarrassed is not really in that sense, because those young carers are recognise that they're young carers. But as I said earlier, there's so many young carers who don't know they're young carers, and that's a big issue where it's about the unidentified group of young carers. But any support I think that the Rotary can provide to their local young carer service would be really welcomed.
Yeah, I mean, things like you're talking about the festival, are they allowed to invite people who are unknown to be carers as such? So that they appreciate they can actually come into this sort of network where they're appreciated for what they're doing, because they don't realise that they're a young carer, So if the festival happens, are they allowed to bring friends who are in similar situations and so on? That sort of thing.
Yeah, what we're trying to do through our work is actually just continue to raise awareness of young carers, trying to also help young carers to self-identify or come forward for support, or other friends. That's sometimes what happens in school is somebody's a young carer and goes to their group, and then they get talking to a friend, they say, oh, you sound as if you're a young carer as well. I've go to this group, and sometimes it's through that word of mouth as well. But as Lorna says, there are some of those reasons. Somebody could be caring for someone who has mental health problems or drug addiction, and people also don't want to talk about some of that.
Yeah,
whereas
exactly.
Someone with a physical
To
disability,
get through to them, that they are a young carer and therefore they qualify for all this. Yeah.
whereas it's much
very
more.
grateful to get the. Yeah.
Oh, sorry, Irene. I think you broke
No,
up.
that's
there,
okay.
I was just going to say, whereas it's much more obvious in the community when someone's caring for someone who's in a wheelchair or has a physical disability, and whether rightly or wrongly, seems to be in some cases less taboo areas of conversation, because people will talk about or more feel confident coming to a young person who is aware that a parent might be may require wheelchair use, versus a young person who they might have some concerns that their parents have mental health problems.
Yeah. Okay, thanks. I shall see how I can best redirect my support.
I'd like to comment on that. First of all, thanks to Lorna and Paul being here tonight. They've shared information and they've raised awareness of issues for young carers. What perhaps can be going forward from this, it's picking up on Irene's point, is making approaches, making the local contacts that both Paul and Lorna were suggesting. That's part of the information that's already been circulated. We'll make that available again. And that's where the Helping Hand of Rotary could begin to make local introductions of the kind, Irene, you're describing, and they'll be local to where you are in the borders. So thanks for bringing that point up. Any word from Rachel? Is she able to be with us?
I think Hugh Kerr had a question.
It really is not a question so much, Paul. It's more to give you our experience. I'm in Rife Valley Rotary, and we have an association with Renfrewshire Young Carers, and have had for a few years. And what we've actually concentrated on is socialisation, trying to remove the isolation, letting young carers meet each other and giving them a fun time. So our budget of over £2,000 each year, we've been taking them to, first of all, go-karting in Hillington. And last year, at the day when it was the action day, we took them to the climb zone at Braehead. And we had 80 young carers over 3 or 4 nights, giving them this chance to do climbing together and then going for a meal in a Chinese restaurant. And we had also members of the Rotary along there too. They didn't climb, but they managed to have a good time talking to the youngsters and having sharing the Chinese meal with them. So our budget, we still have that for this year, and we will certainly take part in the Young Carers Action Day on the 23rd of March. But another point I would also make is that I was a head teacher in the big secondary school. And in the secondary school, we had guidance teachers. And I now look back at my career and I think I was not understanding enough of young people who would come in late or different things. And I think there's much more awareness, and I certainly applaud what you're doing in training teachers, because when you think about it, what's the main influence in young people's lives really? It's school. School is a huge influence. And if they can get an association with understanding teachers who are going to be helpful to them, then that's going to be a big influence in their lives. And I would certainly encourage you to make more initiatives in contacting schools and young teachers and probationers and all the rest of it. I applaud you for doing that.
Yes. Joe, aren't there some other experiences and examples we could share tonight?
There are, but I was just going to follow on from that point. Lizette, bless her, from Livingston was going to tell us about what they've been doing, but the conversation has flowed really well. I think Rachel has had technical issues, so I think between Lorna and I think she's possibly not going to make it this evening. But just following on from the previous question, a point that Paul raised, where he said that there should be a dedicated teacher with a focus on young carers in each of the schools. Don't we as Rotary, we already have an in with our host schools and our primary schools with some of the competitions that we run, and some of the events that we do there. Do we not, or could we speak to those teachers if we find out who they are and actually ask them what help they need? Would that be any good, or is that embarrassing potentially the young carers? Oh, Rachel's come in. I will shut up.
Perhaps, Lorna, you would like to make a quick introduction for us?
Hi, Rachel. Oh, she's just still connecting to the audio.
Yeah, I just know, yeah.
Hi, Rachel.
Hi.
Hi, Rachel. Thanks so much for joining us.
Sorry, I'm late.
No, save the best for last.
Yeah,
thank you so
it's
much.
Slight technical difficulties, but I got there.
I know, thank you so much for persevering with it. That was so good of you. Thank you.
No problem.
I don't know if I could just hand over to Rachel then. No, I know, Rachel, you were going to tell us a wee bit about yourself and your kind of, or sorry, David, I'll let you introduce.
I just want to say welcome, Rachel. Glad you're here. And we just love to hear a few words from you, a bit of your story.
Okay, thank you. I'm currently in the car, so I'll put my camera on. Up. So that's why I'm just doing it from in the car. But yeah. Oh, I'm missing off. So I put my camera on. Hello.
Hi Rachel, we can hear you. How are you doing? Nice to see you again.
Sorry. I don't know if it's my camera that's making it go worse or what it is.
That's fine, Rachel. We've got you now. Don't worry.
Okay. Can you hear me okay?
Yeah.
Yes.
Fine, thanks.
Okay. So I'm Rachel. I'm 16 and I do horse riding. So I've been a young carer for probably 5 or 6 years now. Is this working okay? Sorry.
Yeah, it's fine. We can hear you and see you. That's great, Rachel. You're doing well. Thank you.
I've been a young carer for about 5 or 6 years now. And the things I do within my caring role is like helping with like housework and helping them out the house. I also occasionally just help get their shoes on or brush their hair and things. Things I like to do to take a break is I love to be around my friends And I also obviously love my horse riding. And the residentials were amazing, especially going to the Carers Festival with the media ambassadors. I made so many friends. And it was also just, so some of the positives about being a young carer are being given opportunities to meet other young people in the same situations, because it makes new friends. It basically encourages me to make new friends, and go out the house when I'm not feeling 100% because something's happened. I love being able to help, like, for me, it's my grandparents. I love to help the older generation just because they gave so much to, like, in their day, they put their part in and they put their work in, so it feels really good to just give that back. The thing that dislike is sometimes not having all the time in the world to spend with my mum. But my mum really does a lot, and we have a lot of time together regardless, because she always makes that time for me. There's also just, like, when they take on well and things, it's not the best situation in the world, but we get through it. So sorry.
No, Rachel, thank you. You're a star for sharing your journey with us.
If the young carers or whatever received any funding, it would help massively towards going more days out and just, like, more time together with young people in similar situations. And for me, I'm with South Ayrshire Care Centre, and they have helped me with things like emotional support, especially when one of my grandparents has gone into hospital. They've helped me massively there, and they've also helped me just connect with, like, more friends, and they've got me in touch with media ambassadors, and I've just been given so many incredible experiences through them that I would never have thought were possible. So yeah, I think that's about it. Sorry.
No, that's brilliant. Lorna, do you want to add anything to Rachel? But thank you, Rachel, very much for coming along and talking to us. It's really nice to see you.
Thank you
so much.
Been late, and I really do apologise for being in the car.
No,
Thank you, Rachel.
you're fine. Thank you.
And we'll send on everybody the link to we watched the Media Ambassador film from last year, but I know the film that you guys made is almost ready, so I'm sure we can send the link on to everybody so you can see kind of what Rachel was part of at the Young Carers Festival this year as well.
I think we're going a residential, and this is September, so I think we're going in October, at the start of October. I think we're going away then, and then I also think we've got Carers Parliament in November. So that'll be, like, a fantastic opportunity to get our voice across.
That's brilliant. Could you explain a little bit about the Carers Parliament? We've got a few minutes. Either you, Rachel, or Lorna.
I don't mind.
Do you want one of us to do it, Rachel?
I don't mind doing it if that's okay.
Yeah, go for it.
So the Carers Parliament is basically what I know from it, and what I've heard is we go and we kind of just, like, get to see any progress happening or anything new coming in, and get to get our voices across to the people that matters and the people that can make those changes happen. So basically, the really important people, and it's just a chance to, like, voice our opinions and what could change differently, or say about anything new that's coming in, and yeah, just so they can have it from, like, our perspective, because, like, we go through it day to day. I think that's roughly what it is. That's what I've heard from it so far.
Summed that up well, Rachel. Just to add that the Carers Parliament is for unpaid carers of all ages. We spoke about the Young Carers Festival, which is for young carers under the age of 18, but the Carers Parliament is for unpaid carers of all ages.
Brilliant. And is there Lorna and Rachel, is there a section in there for young carers on the Carers Parliament?
Yeah, and that's where Rachel will be involved in presenting the work that they've been undertaking as well.
Brilliant. That sounds amazing, Rachel.
Yeah, I'm really looking forward to it. So
brilliant.
It'll be nice to
Good
go
luck
and...
with that.
Thank you so much.
That's
Thank
all
you,
right. No
Rachel.
worries. So I think we're coming to the end, really, aren't we? Unfortunately, we're running out of time.
Yeah. Yes, let's just pull a few things together here. But first of all, thanks, Rachel, for making the time and joining in and just sharing with us your thoughts, that experience. And you've given us a few things to take away as well. So how are we going to pull all this together? Come back to Lorna and Paul in just a moment. It is being recorded. There's good material here that can be shared, and there are other links we can integrate and build into this. But it's obviously what we can start to disperse by way of information, the contacts, the networks, and the information. What might be one or two critical things we could have in mind that take away from tonight before we finish? And is there maybe still the example that Joe, you mentioned earlier, about just another kind of Rotary project, a Rotary experience? Or maybe have we covered enough tonight?
I think we probably covered enough, and Lizette has had to leave, but she was fine with she wanted to hear Rachel and Lorna and Paul, so she was fine. And I promised that we'll put Livingston Rotary on another session to hear about the work that they've been doing with carers, particularly young carers as well. So I think we're probably about up to time, David.
Right. So how about just the resume is perhaps to Lorna, Paul, key things just to pick up on and just say 30 seconds, 60 seconds.
Yeah, no worries.
Thank you, David. I mean, I think for us, I think what we would really like people to go away and think about is how can you first think young carer, and recognising that, you know, that young carers are in every community, in every classroom, as I said earlier on, in every school, that you'll find young carers, in every situation and from every background. Do you know that the situation is that you'll have young carers who are younger, as Lorna says. We've got some young carers who are young caring from the age of 5 that we're aware of. There's a small amount of data that says that there's about 400 young carers in Scotland who are under 5 as well. But also, you've got young carers who are 16, 17, looking to go to college or university, looking at their own aspirations in life as well. So really, that I think my parting word is really maybe think young carer and think actually what can the Rotary do. And remember, young carers are children and young people first and foremost, and should have the same opportunities as any child or young person has, to be able to progress and do the things they want to do as well. Lorna, you wanting to say?
I think, Paul, that's not always my tagline, is think young carer. And you know, please don't hesitate to reach out, or if you want to be linked in with your local young carer service to support them as well. Or again, as the lady mentioned as well, maybe if you know somebody that's maybe as a young carer and you're wanting a bit of advice on how to approach them about getting support, again, we're always happy to make those links. But I think that's always a tagline we ask people to go away, is think young carer.
That's a good ask. Thank you for putting it that way. If we're coming to a close, it's going to be to say thank you, Rachel, thank you, Paul, thank you, Lorna, for being here and sharing everything. And I'm certain there's much more you could have said if we'd have stayed here for 3 hours, but we do look to run for about an hour. But there's opportunity to follow up after tonight. And also thank you to everybody who gave their time to be part of this discussion, and hopefully, please, you will share it. You will use it in some way. You will look for a link and follow up some or several points that have been made here tonight. Joe, any last points you'd like to pick up on?
Yeah, just again, echo my thanks to Rachel, Lorna and Paul, and also thanks to Andy. I hope we've given you some things to think about. As I said, this is the third in the series. There will be information coming out and links to you, but our email addresses, both mine and David, will be on the thank you letter. So please get in touch. If you've got any thoughts to share or you want further links, you'll have our email addresses and we can get information from Lorna and Paul, and indeed from Don Williamson at Shared Care. And also the previous webinar was about carers centres as well. So the link to that will be on the letter coming out to you all. But honestly, Lorna, Paul, Rachel, thank you so much. We couldn't do this without you. Thank you.
Yes. Thank you for everything you do.